Top Med Talk.
Hello and welcome to Top Med Talk, coming to you from Melbourne, Australia, where we're at the World Congress of Prehabilitation and Perioperative Medicine, being held in conjunction with the Australian ERAS Plus conference.
A fantastic meeting. Been really good. Folk from around the world, as well as lots of local Australians. I'm sure that had something to do with the fact that the debate was won by Team Australia. Really good meeting, really well organised.
So Kate Leslie and Mike Grocott and the crew, the Top Med Talk crew, have been to the World Congress. We've been to ANZCA at Top Med Talk Down Under. We've been to the Prato meeting, the European meeting. And the last time we saw each other was at EBPOM in Dingle.
EBPOM Island in Dingle,
Yes.
west coast of Ireland, last week.
Yeah.
Meeting.
It is a great meeting. It's a small meeting, but it's got abstracts, which are good, and it's got breaking trials, and it's got plenary lectures, and it's got a great program of getting to know Western Ireland. The Blasket Centre and a Cayley, that was fun, and one or two Guinnesses here and there in the great bars in Dingle. So when is it next year?
So we like to think of it as small but perfectly formed. Next year, we're slightly early in the year, so we're going to be the 16th to the 18th of September. So a bit more light, a bit warmer, would be even better. It always rains at some point during Ireland. It wouldn't look so wonderful and green if it didn't rain.
That's true. It's raining in Melbourne at the moment, but nevertheless, we're having a terrific time, and we've got some terrific guests. In fact, the co-conveners of the meeting, Professor Bernard Riedel and Professor Linda Denehy. Welcome to the podcast.
Thank you.
Good.
Linda, tell us a bit about your professional background and also how you came to be convening the conference.
I'm a physiotherapist and I was a clinician for 20 years at the Austin Hospital in Melbourne, and I worked in thoracic medicine and surgery and ICU. I had students all the time, couldn't answer all their questions, so I thought maybe I need to go and do some research. So I went to Melbourne Uni and I'd been there for a while. I got a joint appointment at Peter Mac in allied health to actually try and raise the capacity of allied health research at Peter Mac. It's only a small department, allied health at Peter Mac, but it's a specialist hospital, the only one in Australia and only cancer. So it was really important for allied health to actually try and raise the bar. So I've been doing that for several years now. At Peter Mac, I met many allied health and anaesthetists involved in prehab, and I got very involved then in prehab since 2017. Actually, when I look back, that's quite a while, isn't it, really, that I've been at Peter Mac. That's how my interest in prehab grew, and just working with the anaesthetists and other researchers in the Department of Health Services research at Peter Mac as well.
Fantastic.
Can I ask that, so is there a national initiative to help allied health professionals, nurses and allied health professionals into research and to support them in research, or is that something that is very locally driven?
There's a Victorian sort of framework for trying to do that, but it's generally locally driven and it's resource. The Special Purposes Fund needs to have some money to actually employ someone. I was only 1 day a week, so it's pretty hard to do too much on 1 day a week, and not all clinicians want to do research. And that's in every profession, right? So you have to hone in on the ones that seem interested and build their capacity. We do that mainly by getting big grants, running research there, having them do outcome measures, having them do intervention, having them help with systematic reviews and those sorts of things. But it's pretty locally driven. Not every hospital in Melbourne has that.
But it's working well. You've mentored some rising stars, some of whom have been presenting at this meeting.
Yes, yeah, look, it is working well. And that's partly Melbourne Uni as well, and having PhD students and seeing them through, and then now they're my postdocs, and the postdocs are helping run the studies, and yeah, it does build capacity. But to do that, I've got to get the grants. And now they have to get the grants as well. We're trying to build capacity in grant writing as well.
Is one of your arch collaborators in that grant writing, I think.
Indeed. Linda and I started writing grants on prehab, I think 2014, if I remember correctly. And we were before our time.
Yeah.
And then subsequently, we've had a lot of success in the recent years. Hilmi Ismail, who you heard recently, we've got an MRFF grant there for AI and risk prediction. That's trying to get the patients identified for prehabilitation, optimizing them. Then with Linda, once we're in the process, Linda's got this fabulous grant around the virtual surgery school called STARS. And that's an RCT that's going to be undertaken shortly. That's around the education of patients virtually, getting them optimized, ready for surgery. And then our collaboration with Daniel Stephenson in Sydney, our RPA, we've undertaken 2 grants, or there's 2 successful grants, of which one study is finishing the recruitment shortly. I think we're in the analysis phase now. And that's randomization to prehabilitation in the community versus a control group. And then the exciting one that's just been funded by MRFF as well is a randomization to a virtual prehabilitation. So we're going to have 2 prehabilitation hubs, one virtually in Sydney, one virtually here in Melbourne at MacCallum Cancer Centre. And then we'll prehabilitate patients for referring hospitals, get them optimized, and then refer them back to the treating hospitals for their surgery, and then support them in the post-op phase. So we've had some good success in the recent years with funding.
Very much looking forward to all of the results of all of these things, which will potentially be presented at a future World Congress.
Absolutely. And a couple of these World Prehab conferences lined up. We just don't know where the destination is yet, do we?
So how did you come to be the convener of this World Congress and also amalgamate it with your very successful Australian ERAS Plus conference?
Yeah, thank you, Kate. What's the origin of ERAS Plus? So at Peter Mac, we've always embraced cardiopulmonary exercise testing. As CPET testing has its roots here in Melbourne. Paul Alder and Bob Smith, and then Adrian Hall was the junior researcher in those years, published their first paper in 1990, if I remember correctly, and a subsequent paper in 1993, showing that the CPET testing and exercise capacity was a good risk predictor. And we subsequently embraced that as a risk predictor, but then moved on to recognizing we need to prehabilitate these patients. Parallel to many other institutions, we've all recognized the same need. The main driver for us is I see periop medicine, and underneath that, the yin and the yang of periop medicine is the way I always describe it. The yin being there's a lot of modifiable risk in patients that leads to a lot of complications. The yang being there's a lot of clinician variability in the care pathways. And that's where ERAS is, measuring compliance with pathways, making sure that we execute our pathways well. And then the prehabilitation is the improving the modifiable risk factors that are in patients. And together, the ERAS and prehabilitation, we've labeled that sort of ERAS Plus. We wouldn't be the first ones to call it that. I've seen it used elsewhere as well. And then we had the opportunities to collaborate internationally with both the EPOM Society, the ERAS Society, POETS, and the International Prehabilitation Society. And so it's been an honor to bring a lot of international guests to Melbourne and really hear from a lot of experts in this field. And it's been a fabulous 3 days.
It certainly has. There's been everything from wonderful plenary lectures, and there was a great Olympics yesterday comparing our prehab programs around the world, and there's a debate this afternoon. And then there's the breaking trials and the emerging leaders presenting their abstracts. So, Linda, what have been the highlights organising the conference with Bernard and also being at the conference?
The first thing, Bernard and ANSCA. And so it's been fantastic to work with all the guys at ANSCA. They've done an amazing job. And
that's the Australian and New Zealand College of Anaesthesiologists for our international listeners.
Yes, and they've supported us in how we're organising it. And we've just got together with Hilmi Ismail to think about what we should have in the conference and who could come, who can talk, who should we invite. And that's been really good fun. And then everyone's rallied and said yes. So it's been really international. I think that's a real plus for me.
And I think the other important part is this is very multidisciplinary as well. It's been fabulous to see a lot of nurses, allied health, dietitians, physiotherapists, psychologists, and then surgeons as well.
And I think for me, listening about diet and the microbiome has been a really plus for me. I really enjoy that and I'm interested in it.
What did you learn in that session?
I probably already knew that I should be eating a Mediterranean diet, let's face it.
Yeah.
And I think also about the micronutrients and also the impact of diet on function, that function and diet are both really important to improve patients if they're deconditioned. It's not just about exercise. And I think everybody needs to really realise that sarcopenia and exercise together with diet are important. Not just exercise.
Can I add to that? The session that I really enjoyed the most was the session that to me said this might be the paradigm shift in prehabilitation, and especially in the realm of the cancer patient. So I'm an anaesthetist, MacCallum is a cancer centre. And the session where the experts presented how exercise and diet and the microbiome impacted cancer pathways. We saw how in some of the colorectal, some of the melanoma, there was cancer regression through these prehabilitation processes, which is very exciting. And so therefore, I think prehabilitation is not just about optimizing deficits in deconditioned patients, optimizing deficits in nutrition, etc., and treating the anxious patient. This is actually now a potential therapeutic aspect to it, where it's, if you've got a cancer, if we can improve your well-being, improve your immune system, and then help you get a better cancer response to the upcoming immunotherapy agents, and also minimize the side effects by having a immune system that's been prehabilitated, by having a microbiome that's been prehabilitated, I think our cancer outcomes are going to improve significantly. And therefore, having these aspects integrated into not just the preoperative pathway, but into the cancer therapy and the cancer journey. And we saw some interesting data as well. If you have a cancer diagnosis and you improve your fitness after your surgery, your longevity is significantly improved. Where if you lose your fitness, your survival is impaired as well. So it's not only just a preoperative, improving your exercise in the post-op phase is also very important.
I think that the mechanistics is really interesting. Even as a physio, I'm much more interested in it over the last few years. And I agree, I think the mechanistics is really interesting. And the other thing, I think it's future, and I think we'll see more work being done on that. And of course, the role of digital. Our colleagues in South Australia have developed this fantastic app-based, community-based, really base level prehabilitation project, which is fantastic. So I see those sorts of digital things for the future. So mechanisms and digital.
Absolutely. And prehab for all of us sitting around this here talking to each other can all have an improved diet and an improved fitness level. So prehab for all, especially if you're preparing for the cancer journey and the cancer surgical resection.
I just find the microbiome blows my mind. There are so billions of microorganisms in our gastrointestinal tract in particular. So you mentioned that might be part of the causal pathway for cancer, or perhaps the causal pathway from the therapy to a cure for cancer. Can you just tell our listeners in basic terms that I might understand how that might all work?
Yeah, you're testing my knowledge here, Kate. An exciting paper, for example, that was published in by, I think if I remember correctly, the first author was Simpson in Nature Medicine, where it was a cohort of melanoma patients. They showed that if your bacteria was in a certain subspecies and more Bacteroides species as opposed to Akkermansia and all those, that your response to your immunotherapy was about 75%, whereas if you had the wrong microbiome, you had about a 50% response.
And were these orally administered chemotherapeutic agents?
So these were immunotherapy agents, correct? I don't want to be 100% definitive on that. I suspect it would be.
Yeah.
It's about priming the immune system inside the cancer environment so that you're responsive to the immunotherapy agents that are given to you. And then the side effects were significantly less as well.
And the other really interesting part of, I think, one of those talks was that you're born with a certain amount of bacteria, good and bad, in your microbiome. And if you're on a lot of antibiotics over time, you lose them and they don't come back. And I thought, oh, I wonder if I've taken a lot of antibiotics. And do probiotics help that? They're very limited in their spectrum. But it was really interesting about the antibiotics and the fact that you probably don't ever get those good and bad bacteria back.
And David Gilkey, the surgeon that presented on melanoma, they said that he's becoming more and more selective with his perioperative antibiotic regime, saying maybe I don't want to give antibiotics.
I always love the introductory bits to those talks, where they how did we get into understanding microbiome, and the passage of the microbiota from mother to child, and the fact that it's different depending on the mode of delivery, it's different on breastfeeding or not. The fact that if you have a family dog, you converge on your dog's microbiome.
Oh, no.
There's some wonderful, if you have obese rats and thin rats, if you transplant the microbiome of one to the other, you can reverse the phenotype.
Talking about transplanting, so he presented a study out of Israel where they took the microbiome of responders, made fecal pellets or whatever, and then gave it to the non-responder patients, and they became responders. That's fascinating stuff.
isn't it?
Good. Fantastic meeting.
Absolutely.
I guess you will continue this series of, I've been lucky enough to come to a couple of these fantastic ERAS Plus prehab meetings here in Melbourne. The prehab meeting we know is going somewhere, but we're not quite sure where yet, although the number of choices is relatively limited. I think one in the north part of North America, one in the boot-shaped thing in Italy, but no more detail than that, and we don't know what order. But we will by the time this podcast goes out. And then we have our EdPom World Congress in London next summer, with I think some ANSTA involvement as well.
Excellent.
And that is on the 8th to 10th of July
Nice.
at the British Library this time. We're moving venues.
Very nice. And then, Bernard, your regular ERAS meeting at the end of the year?
Yeah, every year we run a periop medicine themed, usually around prehabilitation and ERAS. Once again, it's about quest for zero complications. So if we can reduce patient modifiable risk and reduce clinician variability, but that's an infinity.
We've had a wonderful time. Thank you very much for having us. We've interviewed some fascinating people, and you'll be able to hear all of those interviews on our website and on the app. If you want to follow us, you can do that on Instagram and Facebook and LinkedIn and YouTube. And if you go to all of those, please give us a big thumbs up. And we look forward to more fantastic conversations, Mike.
Top Med Talk.
Thanks for downloading Top Med Talk. Don't forget to subscribe, check us out on YouTube, and of course on social media. We're on Instagram, Facebook and X. Also, it's important to remember that Top Med Talk is the broadcasting arm of EdPom, evidence-based perioperative medicine. We'd love you to find out more about that, and the way to do that is edpom.org. Check out our website and find out about some of the incredible conferences we're going to be arranging across the year. edpom.org.